And welcome back. Thanks for joining us. I'm Mabel, Jong, and you're watching WHCC TV, coming to you live from Washington, D.C. Today we're going to be talking more about how nurses can be really invited to the table and to take part in discussions about innovation and other things affecting patients in this healthcare environment. Bonnie Clipper is here. She is Vice President, Innovation at American Nurses Association. Nice to see you, Bonnie.
Thank you very much, Mabel.
Well, we talked a little bit off camera about why it's taken so long to have more nurses' voices heard. Well, first of all, give me a little bit of background on what got us here and why there aren't more nurses around.
You know, we're an incredibly traditionalist profession, right? So it's a new opportunity for us really to step up and engage in conversations around change, around innovation, about what it is we bring to the table when it comes to transforming health. So it's a great time for nurses to be involved. Part of what we overcome is that we don't always tell our story very well. So when you talk to a room full of people that are not nurses, what they think of us is really a bunch of people that provide direct patient care. We should have scrubs on, whether they be blue or whether they be white, a stethoscope around our neck, and we should be providing patient care. We've really changed a lot. So certainly our primary role is patient care. However, there are many of us that do other things, and we are still all nurses. We're all trained the same way. We have great critical thinking skills. We're able to assess situations, to do coordination, management, certainly a lot of functions around how we can improve not only patient care, wellness, well-being, but also how we can problem solve. So it's a great time for us now to get involved in transforming basically the health of the country.
By choice, nurses have primarily been in the background in the past. But are you seeing that leadership at organizations like the American Nurses Association are encouraging more people to be out there to have a viewpoint about what's happening?
Sure, and I'm not sure it's all by choice, right? I think that historically that's the way it was. Remember, we're still 90% female, so I think we continue to evolve, right, and learn about how women can kind of catalyze and step up together. So I think we continue to see that in our own profession. Also, it's not uncommon for nurses to not having been the go-to people for problems, but rather to go to physicians that tended to be male. That's really changed quite a bit. So nurses are certainly a large part of that conversation. Much of what we do at the American Nurses Association really is to educate. We want to make sure that nurses tell their own stories well, and we really do a lot of advocacy and a lot of work to make sure the public understands what nurses do. And the public does understand to a large degree. For 17 years, nurses have been voted to have kind of the highest sense of integrity of any profession. So the public does see us that way. It's really now an opportunity for us to get much more involved and to be at the table at the right time in the conversations that are shaping care.
You have the title of Vice President Innovation at the American Nurses Association. What does that mean? What are you in charge of?
I have the most fun role at the ANA. So for me, what that means is that we actually built innovation framework. It's really around kind of cultivating an innovative spirit. It's around educating nurses, and it's about recognizing the work that they do. So last week we had our own Quality and Innovation Conference. We actually gave away $75,000 in prize money to nurses who have absolutely amazing technologies that they've developed and now have their own companies that are trying to improve the way that we deliver patient care. So nurses are doing a lot in that space, yet not getting the recognition that they really should have. We also do a lot of education work. So it's not uncommon when I speak across the country, nurses don't know that they're innovators, right? So I'll ask a room of nurses, raise your hand if you're an innovator. I'll see a few hands go up. Say, raise your hand if you've actually had to ever use a workaround to care for a patient. More hands go up. And then I'll say, raise your hand if you've actually ever MacGyvered anything to care for a patient. By the end of that, all the hands are up. So nurses don't know the word innovator, yet they innovate all the time. And in our language, in nurse speak, we just do what we have to do to care for the patient. That's innovation.
Is it a concern that there's still a shortage of nurses?
You know, I think that we're going to have to figure out how to work with that shortage, right? We're 1 million nurses short. We're not going to be able to produce them rapidly enough. So we're going to have to look at how we can leverage technology to help us. We also want to make sure that nurses are operating at the top of their license. And there are many, many states that restrict that. So we need to make sure that we actually get nurses practicing at the top of their license. And there are a lot of things that nurses have done in the past that we hang on to. For example, the tasks and activities of starting IVs, drawing blood, phlebotomy work. Those are things that can actually be delegated. What we should be doing and where our expertise, it's really around care coordination and care management and leveraging those skills. So I think technology is going to have to become our friend as we figure out how we can deliver care differently.
What's the root cause of the shortage?
You know, I think it's a variety of things. Right now, we're actually seeing that our boomer nurses are actually retiring. In 2015, we actually experienced a workforce shift. So we were a boomer-heavy profession, and in 15 it flipped. Now it's a millennial-heavy profession because boomers are retiring. So there are a lot of organizations that have gotten very creative about how they can keep boomers at the bedside, whether it's using them fewer days a week, at PRN shifts, working shorter shifts, keeping them on as mentors, staffing them in their technology centers, using them in virtual care. There are a lot of very creative ways that we're seeing that kind of utilize those workers that might otherwise retire. We also are really working very hard to get young nurses into the pipeline. So it's really kind of a dynamic on both ends right now.
All right, Bonnie Clipper. And may I ask, how are you enjoying the conference so far?
It's been good. It's been awesome. I want to see more nurses here next year.
All righty. We'll look forward to that.
Awesome.
Thanks, Bonnie.
All right, thanks.
And thank you to you for tuning in. Stay with us. We have much more to come.